are some of the hottest trends in cosmetic and plastic surgery, and joining us now to tell us all about them is Dr. Alberico Sessa, a Suncoast Cosmetic Surgeon and one of my Suncoast Health partners. So good to see you again.
Thank you. Nice to be here.
One of the hottest trends is fat grafting. You were telling me before we went on, there's just been an explosion of literature about it. Tell us.
Yeah. Well, the hottest trends right now are stem cells, and they're finding out that fat cells, believe it or not, could have more stem cells than bone marrow. And we noticed this where we take fat from one part of the body and we place it in another part, hence the word fat grafting. Most of the time it's of the face, in and around the eyes or around the folds around the mouth or the nose. But the thing that we've noticed is that it gives a more youthful appearance to the skin, as well as allowing for more volume.
Now, I know we have a photo of before and after of some fat grafting. John, if you could show that photo. That is not the photo. There's a different one, John. There it is. And that, doctor, tell us about that.
Sure. Well, she was concerned about the lines around her mouth and her nose, as well as the hollowness around her eyes. And we took some fat from another part of her body and we placed it up around her face, and believe it or not, that's only about an hour of minor surgery there, most of the time done under just some local anesthesia.
And what about recovery?
Just, very standard 2 to 3 days of mild bruising, but not very uncomfortable at all. So
this would be in place of a filler such as Juvederm or Restylane, and what about how much longer it lasts versus the fillers?
Well, the nice thing about fat grafting is that you tend to lose a portion of it, but whatever you keep pretty much for your life. As long as it gets revascularized properly, then it's part of your tissue again.
Now, I have a very full face. I would be afraid to go ahead and add any more fat to this face, but I guess if as you age you have hollow areas under your eyes, then it would be a good option. Who's a candidate?
Absolutely. Well, pretty much anyone that had this particular patient was, believe it or not, she was about 42 or 43 years old. Really depending on how much sun exposure you have, and your lifestyle depends on how quickly you age. Okay. Some of us do it quicker than others.
Okay. Now, you're also talking about, as a hot trend, fractionated lasers. And
that's right.
To our director, John, if you could show us that other photo now, which shows a fractionated laser patient.
This is a nice result. Patients here, we live in a very sunny place, and there's a lot of sun damage. I use a carbon dioxide fractionated laser. The procedure usually takes about just under an hour to do a whole face, and we usually just do it under some local anesthesia, some topical.
And what does it do?
Well, what it does is it resurfaces your skin. It's really my primary focus for wrinkle reduction. If someone has wrinkles around their eyes or around their face or on their cheeks, this is the main thing that I recommend to them in terms of a more youthful appearance to their skin, regaining collagen.
Now, lasers have been around for a while, but this one is different. Tell us how.
Well, carbon dioxide laser came around in the early 90s, and it was touted as sort of the gold standard of laser and skin resurfacing. But as time progressed, the downtime associated with just ablative treatments was a little bit too long, and patients didn't appreciate it. So the technology evolved to where it is now, where it's fractionated, where it just comes out speckled on your face. But what that allows is your body to regenerate and get back to your levels preoperatively at a quicker pace.
It's renewing the cells?
Well, it's not so much renewing them, it sort of jump starts them, it excites them to sort of turn over more collagen and build more collagen quickly.
Terrific. Well, thank you so much, Dr. Alberico Sessa.
Nice being here.
Good to see you again, and you'll be back, I know, and if you'd like more information before then, just go to our website, mysuncoast.com, click on My Suncoast Health, and that's where you'll find the website for Dr. Sessa. And now let's go to Chief Meteorologist Bob Harrigan. Bob?